Mr. President, I am deeply relieved that the majority leader has delayed a vote on the Republicans' cruel bill to rip up health care for 22 million people. People in Massachusetts and across the country spoke out against this terrible bill, and today they prove that they can make their voices heard. But let's be clear. The Republicans' so-called health care bill has come back to life already more times than the scariest zombie in a horror movie. And despite how deeply unpopular this bill is and how hurtful it would be to families across the country, Senator McConnell says he intends to vote as soon as the Senate returns, in a little more than a week. That means Senate Republicans still stand on the brink of passing legislation that will end health insurance coverage for 22 million people in America. Make no mistake, if this plan passes, the rich will get richer and other people will die. I know that is a strong statement, and I know some people don't want to hear it, and I know some people will hear it, but they don't want to believe it. But facts matter, and here's the fact that Republicans simply want to ignore. People without health care coverage are more likely to die than people with health care coverage. For many Americans, health insurance is a matter of life and death. Decades of rigorous academic research back this up. The data show that people with no health insurance die earlier than those with coverage. For example, a 2009 study published in the American Journal of Public Health found that uninsured people died at significantly faster rates than those with insurance. The authors claimed that lack of health insurance was associated with nearly 45,000 American lives lost in just 1 year. 45,000 American lives lost in 1 year. That's more people in this country dying from lack of health insurance than from breast cancer. And the impact isn't limited to adults. Johns Hopkins researchers found that sick kids without insurance who end up in the hospital are 60% more likely to die than the children down the hall who had health insurance. In 2012, a study in the New England Journal of Medicine compared states that expanded Medicaid, which provided coverage to millions of low-income Americans, to those that didn't. They found that for every 100,000 people in states that did not expand Medicaid, nearly 20 more people died every year than in the states that expanded Medicaid. That's right, more people died in states that refused to expand Medicaid. Now, we know a lot about this in Massachusetts, which has been one of the best test cases for understanding how insurance affects death rates. We've been working for years, long before the Affordable Care Act, to expand health coverage. Today, with the help of the Affordable Care Act, more than 97% of people in Massachusetts have health insurance. That is the highest coverage rate in the entire country. Researchers from Harvard and the Urban Institute studied our health reforms to figure out the impact of expanding coverage. Their results, a 2014 study published in the Annals of Internal Medicine, found that Massachusetts health reform was associated with a 4.5% drop in preventable deaths. These data suggest that nationwide, the ACA's coverage expansions are already preventing 24,000 deaths a year, and it's an effect in only 31 out of 50 states. I could keep going, but the consensus is clear. A new study, hot off the press in the Annals of Internal Medicine, put it bluntly: the case for coverage is strong. The reasons are actually pretty straightforward. People who don't have access to high-quality, affordable care, people who work as hard as they can but just don't have the money, can't go to a doctor when they need to, can't get preventive care like breast cancer screenings and vaccinations, can't fill the prescriptions they need to stay healthy. When someone doesn't have coverage, they typically wait to go to the doctor until things get really bad, when the cough turns into a rattle, or when the lump gets too scary to ignore, or the backache makes it impossible even to walk. This is the reason why everyone who actually works in healthcare, doctors, nurses, hospitals, patient groups, researchers, experts, everyone is coming out against the Republican bill. The American Medical Association, the nation's largest association of doctors, says that the Republican bill violates the most basic principle of medicine. First, do no harm. The National Council for Behavioral Health, whose 2,900 member organizations provide mental health care and addiction treatment for 10 million Americans, said the bill would, quote, cost hundreds of thousands of lives. National Nurses United, representing 150,000 registered nurses across the country, said the bill would, quote, prove to be deadly for our nation's seniors. The president of a leading coalition of safety net hospitals said about the Republican bill, quote, let's not mince words. People will die. If the Republican bill passes, people will die. That's what the healthcare professionals are telling us. The Republican plan to kick 22 million people off their health insurance. They want to slash tax credits that help people afford their premiums. They want to open the door to insurance companies offering plans with higher costs and less coverage. And why? Nothing in this bill, not one thing, improves health care for anyone. Not one thing. Nope. The only reason for this bill is to finance $569 billion in tax cuts for a handful of millionaires and billionaires. There's been a lot of concern about the discussion of healthcare getting overheated, but the facts don't lie. The academic studies don't mince words. If the Republican health bill passes, tens of thousands of people in this country will die every year. Republicans can ignore these facts. They can turn away from the studies. They can pretend they don't know what's going on. But the people who lose their health care, the babies, the women, the seniors in nursing homes, the people with disabilities, the workers who get hurt on the job, the people who get hit by heart attacks and strokes and diabetes, they will suffer all the same. Yes, if the Republicans go forward with their bill, people will die. Those are the facts. We have less than 2 weeks to make sure the Republicans hear from everyone in this country who wants them to abandon this terrible bill once and for all. Thank you, Mr. President. I yield.